What is cystic fibrosis? Cystic fibrosis is a serious genetic condition that causes severe damage to the respiratory and digestive systems. This damage often results from a buildup of thick, sticky mucus in the organs. The most commonly affected organs include the lungs, pancreas, liver, intestines. Cystic fibrosis affects the cells that produce sweat, mucus, and digestive enzymes. Normally, these secreted fluids are thin and smooth like olive oil. Please subscribe. What are the symptoms of cystic fibrosis? The symptoms of cystic fibrosis can vary depending on the person and the severity of the condition. The age at which symptoms develop can also differ. Symptoms may appear at infancy, but for other children, symptoms may not begin until after puberty or even later in life. As time passes, the symptoms associated with the disease may get better or worse. One of the first signs of cystic fibrosis is a strong salty taste to the skin. Parents of children with cystic fibrosis have mentioned tasting this saltiness when kissing their children. Other symptoms of cystic fibrosis result from complications that affect the lungs, the pancreas, the liver, other glandular organs. How is cystic fibrosis treated? Although there is no cure for cystic fibrosis, there are various treatments available that may help relieve symptoms and reduce the risk of complications. Medications. Antibiotics may be prescribed to get rid of a lung infection and to prevent another infection from occurring in the future. They're usually given as liquids, tablets, or capsules. In more severe cases, injections or infusions of antibiotics can be given intravenously, or through a vein. Mucus-thinning medications make the mucus thinner and less sticky. They also help you to cough up the mucus so it leaves the lungs. This significantly improves lung function. Nonsteroidal anti-inflammatory drugs (NSAIDs), such as ibuprofen and indomethacin, may help reduce any pain and fever associated with cystic fibrosis. Bronchodilators relax the muscles around the tubes that carry air to the lungs, which helps increase airflow. You can take this medication through an inhaler or a nebulizer. Bowel surgery is an emergency surgery that involves the removal of a section of the bowel. It may be performed to relieve a blockage in the bowels. Cystic fibrosis may interfere with digestion and prevent the absorption of nutrients from food. A feeding tube to supply nutrition can be passed through the nose or surgically inserted directly into the stomach. A lung transplant involves removing a damaged lung and replacing it with a healthy one, usually from a deceased donor. The surgery may be necessary when someone with cystic fibrosis has severe breathing problems. In some cases, both lungs may need to be replaced. This can potentially lead to serious complications after surgery, including pneumonia. How can cystic fibrosis be prevented? Cystic fibrosis can't be prevented. However, genetic testing should be performed for couples who have cystic fibrosis or who have relatives with the disease. Genetic testing can determine a child's risk for cystic fibrosis by testing samples of blood or saliva from each parent. Tests can also be performed on you if you're pregnant and concerned about your baby's risk. Please subscribe to our channel to motivate us. Thank you.